right, good to have you with us here on the South African Morning. We're heading up to 8 minutes away from 7 o'clock. It's been 9 months after a devastating fire where Charlotte Maxeke Academic Hospital still has not been fully repaired. Key parts of the facility were destroyed, and this has had a crippling effect on Gauteng's health system, which of course services tens of thousands of people. So what is going on? Can we get on with doing good hospital work? Let's find out from the hospital's head of internal medicine, Professor Adam Mahomed, joining us this morning. Professor, good to have you with us. Thank you so much, as always, for your time. I'm going to talk about the day-to-day dealings of how you're able to do your job and assist those who need your help in a moment. Can I just ask, first of all, if you don't mind, what is your understanding of why it's taking so long? Surely you've asked those questions.
Yeah, good morning, and thank you to your viewers also to getting in. To be honest, nothing of substance has occurred from last year to now. There are lots of rumblings and conversations happening now. The MEC and Health was at the hospital on Friday. But if you're asking me, has anything happened to the hospital to fix up the hospital? The answer is zero. We're still running at 40% capacity. Patients are getting a suboptimal care, waiting long times. We have a shambles with CT scans, MRIs. There are so many tender issues. So we know better off than what we were 9 months ago. And now people all of a sudden want to have conversations. There's no plan, and every time we hear it's money from DID, maybe April. We have lots of private companies wanting to get involved. Again, politics, DID, red tape is compromising patients' care.
And Prof, and I'm sure there's a priority list. I know it's an impossible way of triaging, if I can use that term, a situation like this, but I'm going to ask you to in a moment. It seems we can't get everything done, but I'm going to ask you about priorities and triaging in a moment. First of all, day to day, take me into your world. What can't you get done? I imagine you're turning desperate, ill people away.
So I think one of the most important things is we don't have access to adequate parking. It might seem pedantic, but when you have a nurse, a doctor, and patients waiting for an hour for a parking bay, for 2 hours for a parking bay, and you're parking on the road, you're parking on the street, crime is still happening, vehicles are getting stolen, you kill the morale. That area where the parking is closed is propped up. Millions are being paid for the last 9 months to fix this, to keep the propping up. But nothing has happened. Conversations about parking occurred in April. Nothing of value is happening. Can you imagine waiting an hour in the sun, waiting to start your clinic at 8, but now you're waiting for parking? The number one concern is parking. An elderly patient with heart failure has to walk half a kilometer to get into the hospital. So the parking is a major consideration. Casualty hopefully will be up in March, but every single system is crumbling. You sit in hospital waiting for 5 to 10 days as an inpatient for a CT scan. You're occupying a bed just for a CT scan. We can't even get a CT scan done in a timeless fashion. Same thing with an MRI machine. There are tenders being put out, tenders being canceled, tenders not going through. There's just an apathy to get the right care to the right patient at the right time. And it's just heartening to say there's conversations happening, but there's no action. There's no accountability. The public protector has reached out, and I've given her a statement about what needs to be done. However, that was after 9 months. Still nothing's happening. And I think there needs to be accountability for why this has taken 9 months and conversations happening. Can you imagine there's no blueprint? There's no structural engineer's report to date on the area damage. 9 months later, no one is held accountable. If I kill a patient, I'm held accountable. When politicians are killing patients, no, it's just another day in the office. I'm sorry for being hard.
No, absolutely. I think the country needs the candor and the honesty in this. Let me leave this as my last question to you. Prof, you said there's a lot of private companies, they want to get involved, they're putting up their hands, they're ready to go. The red tape is in the way. I'm always going to imagine gift of the givers. Miraculously, Imtiaz Suleiman and that organization make things happen. If someone's watching now and we could get past the red tape, and you, Professor, are able to choose one thing today, maybe before the weekend, that someone can assist with, what is that? Final question.
Everyone get up, make a noise, and tell the government, tell the president, tell the ministers, please make this a priority, like what we did with COVID-19. You went and made COVID-19 a priority. Make this a priority. We can have this hospital done in 6 months. If China can build a hospital in 14 days, we can do this. If the mind and willpower is there, gift of the givers, Imtiaz Suleiman has already reached out. He's still waiting for feedback from the government, and it's 3 weeks later. And he's saying, don't worry, no expense to you, government. Wits University has reached out with free engineering. The Dean of the Faculty of Health Sciences has reached out with any help he can give. Doors are being shut. We need to think bigger and think about the patients as our #1 priority. Everyone put pressure on the government to get this hospital up and running, and also the other hospitals in southern Gauteng are also in desperate need of help. Let's mobilize as a country and get this government working for us.
Professor, I always appreciate your time in speaking to us this morning, unpacking very clearly just how bad the situation is. The call there from Professor Adam Mahomed, Charlotte Maxeke Academic Hospital, head of internal medicine. It's the man at the top saying it is nothing short of a cataclysmic disaster. Where is government? Are they hearing these conversations? I guarantee you we are going to follow up. We're heading up to